I just thought of all of the compensations and adaptations that you could consider for ADLs to make people's lives easier. And I know somebody mentioned earlier, like how to make it better instead of compensating, but I think of this as a way to make it better because they're not so frustrated and they can do things themselves and not need so much help with it. So I do still think that's making it better, even though it is compensatory in nature. It really allows them to be able to rely on other people less, which I really think helps with their own self-efficacy and just feeling better about themselves overall. So thinking about clothes without, or these are some of the things that you can probably try or suggest for them. Clothes without fasteners. V-necks are always easier to put on than crew necks. I always tell people to go up one size if they can. If aesthetic wise, there, let me tell them that. Pull-on pants, Kizik's or other types of step-in shoes, pull-on bras, bralettes, or front clasp bras if they can do those, because a regular bra is way too hard for someone who has ataxia. Wash mitts, which I have a picture of, that it just fits over. It's just like you think, fits over the hand. There's even some that you put there's a soap pocket, so the bar of soap goes in there. That way they don't have to hold on to an actual washcloth. They don't have to hold on to soap that they'll probably drop. Makes their life so much easier for bathing. Soap on a rope so that if they do drop the soap, it's not all the way on the ground and then they reach for it and they fall off of their chair or they fall down in the shower. Showers are usually where people slip and hit their heads on the tile. I've had many a traumatic brain injury patient for that reason, so we're trying to definitely avoid that. Adapted cutting board, which I have some pictures of later on, thinking about using a squeeze tube body wash instead of something where they have to unscrew the cap, which is harder. Maybe they just have something where they squeeze it and it lets the body wash out on their own. Electric toothbrush, instead of having to do that back and forth movement, they just hold the toothbrush that way and let the toothbrush do the work. A water pick instead of flossing, because trying to floss with ataxia, you could really knock yourself out potentially with that. So a water pick will be a lot easier for them to use. I have a picture of mounted toothpaste and hand soap on the next slide where it mounts to your wall and then you just stick the toothpaste underneath it or the toothbrush under it and it spits out the toothpaste for you instead of messing with that small cap of toothpaste and trying to manage the small fastener. Speech to text functions for people who have a hard time with texting, using Siri and other speech to text modalities just to make things easier for them and less frustrating. Using figure four for lower body dressing in a supported position. Maybe they're leaning up against a chair, or if they're in the bed, they can scoot back in the bed, lean up against their headboard. They have some shower chairs out there that have safety belts, which could be helpful, especially if someone wants to reach for different things in their shower. I've also used a gate belt and just tied it around somebody while they sit on the shower chair as well, if their seatbelt is not coming with their shower chair, just to give that extra level of safety. Putting Dyson, or really Dyson is expensive. So what I buy is shelf liner from the dollar store and put it underneath their plate or hot glue it to the bottom of a plate that I found online so that it gives them a little bit of traction on their counter when they're eating. And the scoop plate helps because it gives them that ridge to scoop up against versus having that freedom of going across the plate as well. So those are just some of those things that are out there that can be really helpful adaptations for these patients as well.